Hello, my name is Jeniffer López, and I'm going to read chapters 5 to 13. 5. Medical Practitioners 1. Practitioners. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council's list, or registered in order to practice. A doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is known as a general practitioner, GP, or a family doctor. GPs usually work in a group practice. Larger group practices work in a building called health center. Note: in British English, the verb is spelled practice and the noun is spelled practice. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the national health services providing private health care may have consulting rooms outside a hospital. For example, the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who provide these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Mrs. So Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes in diseases of the heart and circulation or cardiology. A geriatrician is a specialist in diseases of elderly patients or geriatrics. An anesthetist specializes in anesthetics. Note: names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of the specialty ends in ICS, the name of the specialist ends in ISIAN. There are some exceptions, for example, anesthetics and anesthetists. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ups by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Now, the collocation good with is followed by a noun. He is good with children. The collocation good at is followed by the ing form gerund of a verb or by a noun. She is good at explaining procedures. She is good at explanations. The exercises. Write sentences to describe the work of the specialist in each branch of medicine. Dermatology, a dermatologist specializes in diseases of the skin. Rheumatology, a rheumatologist specializes in diseases of the joints. Traumatology specializes in accidents and emergencies, and pediatrics. A pediatrician specializes in diseases affecting children. Obstetrics, an obstetrician specializes in managing pregnancies. Complete the table with words from A, B, and C opposite. Verb specialized, a specialist, a specialty. Practice, practice and practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, and graduation. Qualified, qualification. Find the prepositions in C opposite that can be used to make a word combinations with the words in the box. A pathologist specializes in diagnosing diseases through examining cells and tissue. A pediatrician must enjoy uh, working with children. An oncologist is uh, interested in the diagnosis of and treatment of cancer. A psychiatrist must be good at counseling. A neurosurgeon must be good with her hands. Make word combinations using a word from each box. Consulting rooms, general practitioner, group practice, health center, internal medicine, and surgical specialties. Chapter 6, Medical Practitioners 2. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups. A pre-registration house officer, PRHO, or a house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the name for these junior doctors is Foundation Year 1 Doctor, FY1. A senior house A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2, but the old terms senior house officer and SHO are still used. A specialist register, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registered doctors who gave. There are also some not training registered doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There are many. There may also be some associated specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Medical teams. Consultants, physicians, and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor collects them and takes their medical history and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests, for example, x-rays or an ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward. For the first time, no on one of the regular work rounds, when the management of the patient is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. On the work round, the consultant is accompanied by the team and a nurse. They they visit all the patients in the consultant's care. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and take turns to be on call, available to return to the hospital if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. Moving to the exercises. Make word combinations using a word from each box. Associate, specialist, house officer, on call, provisional diagnosis, radio pager, and ward round. Match the descriptions. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to the ward 60. He is a consultant. Dr. Stewart has just started the second year of her foundation program. She is a SHO. Dr. Singh has started his training as a surgeon. He is a specialist registered. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. He is a PRHO or house officer. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. He is a medical director. Are the following statements true or false? A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called Foundation Program. That's true. Then the name senior house officer is no longer used in Britain. Yeah, it's false. The consultant is usually the first doctors to see the new patient. No, it's false. Uh, when working in shifts, all doctors take turns to be on call. No, that's false. Complete the test of a PRHO describing her job. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last uh, shift to find out if there were any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her wire round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request from request forms for blood tests, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Chapter 7, Nurses. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who's still in training; a staff nurse, a nurse who has completed the training course; a church nurse, a more experienced nurse who is in charge of or responsible for a ward or department; nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still sometimes used for a female church nurse. A female nurse manager may be called matron. Example: Dr. James is talking to Sister Watkins. Support workers. The clinical support workers who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerks whose duties include making sure patients' notes and information are up to date and answering the telephone. Specialization. Like doctors and nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. A nurse's role. The nurse's role has changed considerably in the recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. My responsibility for nurses is planned, as the following article demonstrates. Nurses carry out surgery in effort to cut patients' waiting list. Nurses in Scotland trained to perform minor surgery have entered the operating theater for the first time in an effort to cut patients' waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The birds performed and carried out are used with all types of procedures. They are often used in the passive form. Perform an examination, an operation, a procedure, an experiment, a test, a biopsy. Carry out an examination, an operation, a procedure, etc. The procedure was performed by a nurse or the procedure was carried out by a nurse. Moving to the exercises. Complete the sentences. Someone who specializes in delivering baby is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. Make word combinations using a word or phrase form from each box. Carry out a procedure, change a dressing, check, check the temperature, give an injection, and remove sutures. Complete the sentences with the correct grammatical form of perform. An stop brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's conditions deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspect, a lumbar puncture must be performed. And last year we performed a randomized double-blind group study. Complete the sentences with the correct grammatical form of carry out. I now intend to carry out a larger study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Chapter 8, Allied Health Professionals. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following. Physios help people to move by getting them to do exercises or by treating their body with heat or massage. Treatment by manipulating muscles and joints with the hands. Occupational therapist help people with disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodictists, also known as podiatrists, treat conditions affecting the feet. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service, and ambulance technicians with more advanced qualifications is called a paramedic. Prosthetists and orthoses. Prosthetists and orthoses provide care for anyone who needs an artificial limb. A prosthesis or device to support or control a part of the body, an orthosis. They also advise on rehabilitation, helping patients to return to normal life and work after treatment. Prosthetists provide artificial replacements for patients who have had an amputation or were born without a limb. Orthoses provide a range of splints and other devices to aid movement, correct deformity from an abnormal development of a part of the body, for example, clubfoot, talipes, and relief pain. Opticians. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside of the eye, and examining the retina. If the optician suspects an eye disease, such as glaucoma, they refer the patient to the GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Exercises. Make word combinations using a word from each box. Ambulance, technicians, artificial limb, clubfoot, contact lenses, lens health professional, intraocular pressure, occupational therapist, and social worker. Which allied health professional could, could best help for the following people? A young unmarried woman who has just had a baby, a social worker, a woman who is having difficulty using her right arm and following a fracture, a physiotherapist, someone who needs glasses, a optician, an elderly woman who has had a below knee amputation, a prosthesis, a man whose wife has Alzheimer's disease, a social worker, a man with a fungal infection of his feet, a podiatrist. Complete the tests. Look and see and ASC. Practice works with patients of all ages as a member of the clinical team based at a large hospital. The patients may need a prosthesis as a result of an accident or an amputation following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational uh, work therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as a part of an outpatient service and also visit other centers to provide service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damaged, any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition of the body or to relieve pain. Chapter 9. Chapter 9. Hospitals. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron, the Royal Infirmary, is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the hospital for sick children. You can see some of the departments in a hospital on the sign. Of course, there are many others, for example, the intensive care unit, ICU, and the surgical high dependency unit, HDU. What does outpatient mean? Outpatients are the people who come to the hospital, attend a clinic, or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. South entrance, Car Park, City ND, visitor and staff, the Simpson Center for Reproductive Health, Gynecology, Maternity, Neonatology, outpatient departments, all wards, day surgery unit and endoscopy, X-ray departments, combined assessment. Outpatients. The Accident and Emergency Department, A&E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by the GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients. The inpatients in a hospital are admitted in one of the three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment that they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, myocardial infarction, or they are seen in the A&E department where the doctor on duty working at the time arrange their admissions. This will happen in the case of a patient with fractured neck or femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Assessed? Yes. Decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Moving to the exercises. Complete the table with words from A, and B, and C. Admit, admissions, assess, assessment, discharge, operate, operation, refer, referral, and treat, treatment. Make word combinations using a word from each box. Acutely ill, assessment unit, on duty, referral letter, and waiting list. Which hospital departments will be the most appropriate for these following patients? A woman in diabetic coma, the intensive care unit. A patient who has just had a radical prostatectomy, high dependency unit. A patient who is to have a skin lesion removed, a day surgery unit. A man with foreign body in his eye, an accident and emergency department. A woman with a treating abortion, gynecology. Complete the extract from from an information left there for patients. Information for our patients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests such as X-ray, which could mean to you're going to another department, or may be referred to other professionals such as physiotherapists or dietitians. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to the hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Chapter 10, Primary Care. The National Health Services. The National Health Service NHS is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as cervical color, with exceptions for some patients, such as children and elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practices are based in a surgery and look after the health from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccinations, for example, for influenza, and may perform minor surgery such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen in an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts to GPs and local GPs to cover if someone is absent. Note, the non-surgery has 3 minutes. The building where GPs work, the practice have moved to a new surgery on the high street. A time when GPs sees patients, minor surgeries from 8:30 to 12:30, and the work of surgeons. The patient needs urgent surgery on a burst appendix. The practice team. A typical GP practice employees receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other healthcare providers, and for filing and scanning documents into patient records. The practice manager has responsibility for finances and sometimes for IT, supervises reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular diseases clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to have their dressing to change dressings, such as user dressings. Health visitors visit families to carry out checkups on young children, particularly under fives, to make sure they are healthy. Um, a special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics from antenatal patients, and physiotherapists provide hands-on treatment but also teach patients exercises they can do to improve their conditions after an accident or operation. A GP's day. Dr. Stewart works in a practice in a small target town with three other family doctors. The surgery is in the center of the town and is shared by three practices. This is a typical working morning when she's not on du- she's not the duty doctor responsible for emergency and urgent problems. At 8 a.m., I arrive at the surgery. Check the OO email printout. Check for urgent and not urgent messages. And 8:30, check emails from health board and partners prepare for surgery. 8:30 to 10:50 a.m. Morning surgery, 6 pre-booked last week, 2 booked 48 hours ahead, 4 booked above on the day, and 10:50 to 10:55. Check with reception for messages, sign prescriptions, and deal with repeat prescriptions. 11 to 11:20, coffee break in the conference room with colleagues. 11:20 to 11:30, check take home visit requests and divide up visits. 11:30 to 1 p.m. home visits. To the exercises, complete the sentences. Children over 6 and over 60 and people with some chronic diseases do not have to pay prescription charges in UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP consultant is 10 minutes long. A locum is someone who takes the place of a staff member when he's on leave. Care outside working hours is known as out of hours treatment. Make a work combinations using work or phrase from each part. Change dresses, make appointments, make home visits, perform minor surgery, refer a patient, run a clinic, supervise staff, and take messages. Which member of a practice team will be responsible for each of the following? Running the clinic for pregnant women, a midwife. Teaching a patient how to straighten his broken leg, a physiotherapist. Letting the GP know that a patient can come to her appointments, receptionist. Running a clinic for people who want to lose weight, a practice nurse. Visiting a patient who has just returned home, after a hernia operation, district nurse. Carrying out checkups on children in a poor neighborhood, health visitor. Organizing cover for an absent doctor and a practice manager. Complete the diary from Dr. Stewart's afternoon. 1 to 2 p.m. practice team meetings over sandwich lunch. 2 to 4 p.m. afternoon surgery. 12 10-minute appointments. 4 to 4:20 coffee break. 4:20 to 5 p.m. check with reception for messages. Deal with home visits and repeat prescriptions requests. 5 to 6 p.m. paperwork, for example, referrals to secondary care, admin tasks, telephone calls to patients, private medical examinations. 6 p.m. phone switch to out of hours service. Chapter 11, Medical Education 1. Medical education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years at medical school, the section of a university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPs or consultants, senior specialists, often delivered through colleges for different specialties. For example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars which doctors undertake throughout their working lives to keep up to date. Extract from an undergraduate prospectus. The MBCHC, the Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1 to 3, an integrated program of clinical and scientific topics, mainly presented through problem-based learning, PBL, where you work with other on a where you work with others on a series of case problems. A student selects nodules. SSMS, allow you to choose from a menu of subjects such as sports medicine or even studying a language as preparation for an overseas elective. A hospital attachments of your own choice between years 4 and 5. Vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 to your course through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments, year 4 and 5. A series of 4-week clinical attachments in medicine, surgery, physiological medicine, child health, obstetrics, and gynecology in general practice. A student's view. Helen is a medical student. Describes her course. I am just finishing my first year of medicine. What I like about this course is that you are involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2 hours in sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5. But now it's mainly group work. Although we do have some lectures and seminars, where we work in small groups with tutors. I like all of it, even the dissections. We get to cut up cadavers for the second month of the course. Moving to the exercises, match these activities to stages of medical education in the UK. Dissecting catheters undergraduates, keeping a log of surgical procedures observed and performed postgraduate. Working for 4 months in accident and emergency to experience his specialty foundation program. Talking of taking a 4-week attachment in obstetrics and gynecology undergraduate. Taking an online course on recent developments in cardiovascular disease. Continuing professional. Complete the sentences. Just before the final year, the students have the chance to take an elective in a hospital of their choice, anywhere in the world. Problem-based learning contrasts with an approach where each subject is taught separately. These days, lectures are often interactive, with regular opportunities for the students to ask questions. In clinical in clinical attachments, students learn how to treat and manage patients. Student select models can be a topic from outside of medicine, such as for a foreign language. The sections of cadavers at at the university. Oh, sorry. This section of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with our lecturer. Match is each of these activities to one of the openings of the undergraduate course. Julie spent 6 weeks working in a small group in a small hospital in the Himalayas, overseas elective. A work a work of students discuss together the possible reason for abdominal pain after meals in an obese 44-year-old male. A problem-based learning PBL. A small group of students treats the pulmonary artery in a cadaver dissection. Otto spends a month working in the pediatric ward of the local hospital. A clinical attachment. Anne learns how to take blood from an elderly patient. Clinical skills. Juma choose to study travel medicine in this 4 year. The student selected model. 12, chapter 12, medical education 2. The foundation program. The foundation program is a 2 year training program which forms the bridge between university level study at medical school and the specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allows the junior doctor known as a trainee to sample different specialties, for example, pediatrics. A year one trainee, FY1, corresponds to pre-registration house officer, PRHO, post, and a year two trainee, FY2, to a senior house officer, SHO posts. Each trainee has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress trainees have to demonstrate a range of clinical competences which are assessed through observation in the workplace. People in medical education, tutor, an academic, or in some cases a postgraduate student who leads tutorials. Demonstrator, in an anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer, senior lecturer, an academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in the discipline. College tutor, a consultant responsible for delivering college training program. Clinical trainer, a consultant assigned to a trainee who provides training during periods of direct clinical care. Educational supervisor, a consultant who supervises a training period of training. Medical qualification, BMSSC, BMedSC, Bachelor of Medical Sciences, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBCHB, MBBS, BMBCH, BMBS. Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MD or DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP, MRCS, member of the Royal College of Physicians of member or member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in the college. FRCS, FRCS Ed, FRCS Class, FRCSI, Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow. For example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further explanation must be passed. Must be passed. For the other colleges, it's by nomination or work assessment. Moving to the exercises. Complete the phrases with verbs from the box. Demonstrate a competence or how to do something. Supervise a trainee by ensuring she successfully, successfully completes her training. Provide a course or training program as a teacher. Take a course or training program as a student. Assess progress or competence. Match the two parts of a sentence. And FY1 is a doctor in the first year of the foundation program. A demonstrator is an anatomy teacher who teaches this section. A clinical trainer is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of training of a trainee. Medical school is part of the university responsible for medical education. Placement is a period spent as a training in a hospital or general practice. A college is a body of specialists responsible for delivering and assessing training for their specialty. And uh, a fellow is a specialist who has reached the highest level in the specialty. Write the full qualification of doctors and surgeons. Mr. A. H. John husband MB CHP FRCS FRCSI. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England, and Fellow of the Royal College of Surgeons of Ireland. 2. Dr. C. Doyle, BMedSci, DM, MRCP. Um, Bachelor of Medical Science, Doctor of Medicine, member of the Royal College Surgeon. Mrs. E. English, B. MBBS, FRCS. Yes. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. Dr. E. Meriwether, BM, MD, FRCP. Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. And lastly, Chapter 13, the Overseas Doctor. Types of registration. To manage 3 patients in UK, all doctors must be registered with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified for medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's medical training in the UK. A specialist registration is for doctors who have completed a specialist medical training and have a certificate of completion of training, CCT. The GP register is a degree register of all those eligible to work in general practice in NHS. Note, for full details of the general PLAB. Before they can obtain a full registration, some categories of overseas doctors are required to take a professional and linguistic assessment board, PLB PLAB test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios known as stations, so to assess professional skills. PLAB stations and advice. OSCEs assess the skills. Clinical examination. Your ability to carry out a physical examination of a simulated patient and actual training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin and an anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient or, in some cases, the examiner will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. Taking. History taking. Your ability to take an accurate history and make a resonant diagnosis will be assessed. Advice on the stations from successful candidates. Read the instruction outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the shards in the charge bin. Don't forget the ABC protocol, always breathing circulation in every emergency station. Shake the patient's understands what is happening. Then ask them about any concerns they may have. Don't just give it a lecture. Listen carefully to what the actor says. Note, sharps are needles and blades which must be disposed of safely in a special container called sharps bin. Exercises. What kind of registration might these doctors obtain? A newly qualified Spanish doctor provide professional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year FY1 full registration. An SHO who has successfully completed the foundation program and gained a certificate, of completion of training after several specially registered posts. Specialist registration. Write the abbreviations in words. Any doctors who want to work in the UK must register with the GMC, the General Medical Council. Some overseas doctors must pass the PLAB test before they can register. The Professional and Linguistic Assessment Board. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol, airways, breathing, and circulation. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. Complete the test. Look at A, B, and C opposite to help you. My name is Musa. I come from Yemen. I came to the UK about 2 years ago. after graduating. Because Yemen is outside the EEA, I could only obtain limited registration. With the GMC at first, it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying about what are you saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration. I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my my second foundation year, I should obtain a CCT, which will allow me to proceed to a specialist registration with the GMC, an important step on the road to becoming a pediatric consultant.
Ahora esas la versión en español de los capítulos 5 al 13 de Professional English News. Capítulo 5. Médicos 1. Médicos. En Gran Bretaña, los médicos, también conocidos como practicantes o médicos practicantes, deben estar calificados y tener un título universitario en medicina. También deben estar registrados, es decir, incluidos en la lista del Consejo Médico General o registrados para poder ejercer. Un médico que trata a los pacientes, a diferencia de uno que solo investiga, se llama clínico. Un médico que brinda atención primaria a los pacientes se conoce como médico general o familiar. eh, familiar. Los médicos generales normalmente trabajan en grupos de prácticas. Un gru- Grandes grupos de prácticas trabajan en un edificio llamado centro de salud. Especialidades. Los médicos especialistas, por ejemplo, los pediatras, generalmente trabajan en hospitales. Sin embargo, aquellos que trabajan fuera del NHS, eh, Servicios Nacionales de Salud, brindando atención médica privada, deben, deben pueden tener salas de consulta fuera de las de un hospital. Por ejemplo, en la famosa calle Harley en London. Ramas principales de medicina son cirugía y medicina interna. Y los doctores que practican estas ramas son cirujanos y médicos, respectivamente. En Gran Bretaña, los cirujanos masculinos se les llama Mister y a las mujeres Misses, señorita. Así que, ah, así que doctor Smith es un médico y la señora Smith es una cirujana. Un cardiólogo se especializa en enfermedades del corazón y la circulación o en cardiología. Un geriátrico se especializa en enfermedades de pacientes envejecientes y un Anestesistas se especializa en anestesias. Nota. Los nombres de especialidades normalmente terminan en ology. Nombres de especialistas usualmente terminan en ologies. Si el nombre de una especialidad termina en X, el nombre del especialista terminará en isha. Hay algunas excepciones, por ejemplo, aesthetics, elegir una especialidad. Jill Matthews se acaba de graduar de la Escuela de Medicina y habla sobre su futuro. Todavía no he decidido en qué especializarme. Necesito más experiencia antes de decidirme, pero me atrae bastante la idea de pediatría porque me gusta trabajar con niños. Sin duda, preferiría trabajar con niños que, digamos, con pacientes ancianos. Así que no me gusta la geriatría. Nunca me interesó mucho la anatomía detallada, por lo que las especialidades quirúrgicas como la neurocirugía no me atraen mucho. Tienes que ser bueno con las manos, lo cual no es un problema para mí. He asistido a varias operaciones eh, e incluso he hecho algunas operaciones menores por mi cuenta, pero los cirujanos tienen que ser capaces de hacer lo mismo una y otra vez sin aburrirse, como ligar arterias cortadas y demás. No creo que eso sea un problema para mí, pero necesitan tomar decisiones rápido y no soy buena en eso. Me gusta tener mi tiempo para pensar, lo que significa que la cirugía probablemente no sea adecuada para mí. Nota, la colocación bueno con va seguido de un sustantivo. Él es bueno con los niños. La colocación bueno en o bueno con es seguida de el gerundio de un verbo o por un sustantivo. Ella es buena explicando procedimientos o ella es buena con las explicaciones. Capítulo 6. Médicos 2. Personal hospitalario. Las personas que trabajan en cualquier tipo de centro de trabajo, incluyendo hospitales, se llaman staff o personal el personal hospitalario en Gran Bretaña, en un hospital inglés, pertenece a uno de cuatro principales grupos. Un oficial interno de preregistro u oficial interno es un médico recién graduado en primer año de formación de posgrado. Después de un año, él o ella se convierte en un médico registrado. El sistema actual de la capacitación, el programa de la fundación, el nombre de esos médicos jóvenes es doctor de la fundación año 1. Un oficial superior de la casa está en segundo año de formación de posgrado. El título todavía de formación de posgrado, el título de doctor de fundación año 2 es el título que se utiliza, pero títulos anteriores o viejos como oficial superior de la casa y SHO se usan todavía. Mm, un registrador especialista es un médico que completó el programa básico y se está capacitando en una de las especialidades médicas. También hay algunos registradores que no están en formación. Son médicos que han completado su formación pero que aún no desean especializarse. Un consultor es un especialista totalmente calificado. También puede haber algunos especialistas asociados, médicos de alto nivel que no desean convertirse en consultores. Además, hay al menos un director eh, o clínico, un director médico o clínico que es responsable de todo el personal médico. Equipos médicos. Los médicos consultores y cirujanos son responsables de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médicos jóvenes para ayudar a cuidar a esos pacientes. En muchos hospitales hay equipos interdisciplinarios que consisten en no solo en médicos, sino también en fisioterapeutas y otros profesionales de la salud afines. Cuando los pacientes ingresan o son admitidos en el hospital, generalmente son vistos primero por uno de los médicos auxiliares en la sala donde recibirán tratamiento y atención. El médico subalterno los atiende, les toma su historial médico y los examina. Algún tiempo después, el registrador también ve a los pacientes y puede ordenar investigaciones o pruebas, por ejemplo, radiografías o un electrocardiograma, hacer un diagnóstico provisional y comenzar el tratamiento. El consultor generalmente ve nuevas admisiones, personas que recientemente ingresaron a la sala por primera vez en una de las rondas regulares de la sala. Cuando se analiza el manejo de los pacientes con el registrador, los consultantes también deciden cuándo un paciente está listo para ser dado de alta, enviado a casa. En la ronda de sala, el consultor, acompañado por el equipo y una enfermera, visitan a todos los pacientes a cargo del conductor. Turno. Ahora, los médicos jóvenes normalmente trabajan en turnos, lo que significa que normalmente trabajan 8 horas todos los días, por ejemplo, de 7 de la mañana a 3 de la tarde, y luego están libres hasta las 7 de la mañana del día siguiente. Después de una semana cambian su turno a un turno diferente, por ejemplo, 3 de la tarde a 11 de la noche, o 11 de la noche a 7 de la mañana. El sistema alternativo es trabajar de 9 de la mañana a 5 de la tarde todos los días y hacer turnos para estar disponibles a regresar al hospital si es necesario, de 5 de la tarde a 9 de la mañana del día siguiente. Los días de guardia se establecen en una lista de nombres y horas. Los médicos de guardia llevan un localizador de radio o blipper, un dispositivo que hace ruido cuando alguien intenta comunicarse con ellos. Capítulo 7. Enfermeras. Grados de enfermería. Las enfermeras que trabajan en un hospital tienen los siguientes grados. Estudiante de enfermería. Una enfermera que sigue en entrenamiento. Enfermera del personal. Una enfermera que ha completado su curso de entrenamiento. Una enfermera a cargo. Una enfermera, eh, una enfermera con más experiencia que está a cargo o es responsable de un departamento o de una sala. Eh, una enfermera jefa, una enfermera que está a cargo de distintas salas o de varias salas. Nota, el término hermana se sigue usando en algunas ocasiones para eh, mujeres enfermeras jefas. Y nota, el término sister o hermana todavía se usa algunas veces para una enfermera a cargo. Una enfermera jefa puede llamarse matrona. Dr. James está hablando con la hermana Watkins. Trabajadores de apoyo. El trabajador de apoyo clínico que ha realizado un curso corto y obtenido calificaciones básicas y el auxiliar de enfermería que generalmente no está calificado ayudan al personal de enfermería. También puede haber empleados de sala cuyas funciones incluyen asegurarse de que las notas e información de los pacientes estén actualizadas y contestar el teléfono. Especialización. Como los médicos, las enfermeras pueden especializarse. Una matrona Se ha especializado desde el principio haciendo un curso de partería, el manejo de embarazo y del parto. Las enfermeras de distrito visitan a los pacientes en sus hogares. Los visitadores sanitarios también trabajan en la comunidad dando consejos sobre promoción de salud y prevención de enfermedades. El papel de la enfermera, el papel de la enfermera ha cambiado considerablemente en los últimos años. Además de la atención general del paciente, controlar la temperatura, el pulso y la presión arterial, cambiar los vendajes, aplicar inyecciones y retirar suturas, las enfermeras ahora hacen algunas de las cosas que antes estaban reservadas a los médicos, como recetar medicamentos y solicitar pruebas de laboratorio. Se prevé una mayor responsabilidad para las enfermeras, como lo demuestra el siguiente artículo. Enfermeras realizan cirugías por un esfuerzo de reducir las listas de espera en los pacientes. Las enfermeras escocesas capacitadas para realizar cirugías menores han ingresado al quirófano por primera vez en un esfuerzo por reducir los tiempos de espera de los pacientes. 5 enfermeras que aprobaron un nuevo curso en la Universidad de Glasgow, Caledonia, ahora están calificadas para llevar a cabo procedimientos tales como la extracción de pequeñas lesiones, lunares benignos y quistes. Los verbos realizar y llevar a cabo son usados con todo tipo de procedimientos. Se usan normalmente en forma pasiva. Mm, per- eh, Realizar una examinación, una operación, un procedimiento, un experimento, un test o una biopsia. Llevar a cabo una examinación, llevar a cabo una operación, un procedimiento, experimento, un test o una biopsia. El procedimiento fue llevado a cabo por una enfermera o el procedimiento fue realizado por una enfermera.
Capítulo 8. Los profesionales aliados de la salud. Salud comunitaria. La salud de la comunidad depende de un gran número de personas, además de los médicos y enfermeras. Estos pueden ser agrupados bajo el nombre de o bajo el título de profesionales aliados de la salud. Incluyen los siguientes: fisioterapeutas, oficios. Ayudan a las personas a ayudan a las personas a moverse poniéndolos a hacer ejercicios o tratando su cuerpo con calor o masaje. Tratamiento, eh, tratamiento, tratamiento, manipulando músculos y arterias con las manos. Los terapeutas ocupacionales ayudan a las personas con discapacidad a realizar tareas del hogar y en el trabajo. Una discapacidad es una condición física o mental que dificulta vivir normalmente, por ejemplo, ceguera o sordera. Los trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, viviendas deficientes o desempleo, o problemas familiares. Los eh, podólogos tratan condiciones que afectan a los pies. Técnicos. Existen numerosos técnicos, personas que trabajan con equipos científicos, como los radiógrafos, a los que se les conoce como técnicos de los rayos X. Ah, los técnicos de ambulancias también trabajan en el servicio de medicina de urgencia. Un técnico de ambulancia con calificaciones más avanzadas se llama paramédico. Prostetistas y ortesistas. Los protetistas y ortesistas brindan atención a cualquier persona que necesite un miembro artificial o una prótesis, o un dispositivo para sostener o controlar una parte del cuerpo, una órtesis. También, también, también asesoran sobre la rehabilitación, ayudando a pacientes a volver a la vida normal vida y trabajo normal después de tratamiento. Los protetistas proporcionan eh, a reemplazos artificiales para pacientes que han tenido una amputación o nacieron sin una extremidad. Los ortopedistas proporcionan una variedad de férulas y otros dispositivos para facilitar el movimiento, corregir la deformidad de un desarrollo o un desarrollo normal de una parte del cuerpo, por ejemplo, el pie sambo, y aliviar el dolor. Ópticos. Los ópticos examinan la vista y recetan anteojos, también conocidos como anteojos, y lentes de contactos cuando son necesarios. El examen incluye medir la presión intraocular, la presión del líquido dentro del ojo y el examen de la retina. Si el óptico sospecha de alguna enfermedad ocular como glaucoma, remite el paciente a su médico de cabecera para recibir tratamiento. El médico de cabecera puede derivar al paciente a un oftalmólogo, un médico que se especializa en enfermedades de los ojos. Capítulo 9. Hospitales. Introducción a un hospital. Jordi Pons es un estudiante de cuarto curso de medicina de Barcelona. Ha venido a Gran Bretaña en un adjunto electivo a la Royal Infirmary Edimburgo. El doctor Barron le presenta el hospital. Doctor Barron. El Royal Infirmary es el nombre del hospital de la Universidad de Edimburgo. El Royal Infirmary es el nombre del Hospital Universitario de la Universidad de Edimburgo. Es un hospital general que atiende todo tipo de pacientes y enfermedades, excepto pediatría. Tenemos un hospital especializado en eso en otra parte de Edimburgo. De Edimburgo. El hospital para niños enfermos. Tú puedes ver algunos departamentos en de nuestro hospital en el letrero. En el letrero. Claro que hay muchos otros, por ejemplo, la unidad de cuidados intensivos o la unidad de alta dependencia quirúrgica. Jordi, ¿qué significa outpatient o ambulatorio? Pacientes ambulatorios son personas que vienen al hospital, van a la clínica, para asistir a una clínica o para tener tratamiento, pruebas o tratamientos y luego regresan a su casa el mismo día. Pacientes internados se quedan en el hospital por y uno o más días. Las habitaciones donde ellos se quedan se llaman salas. Si el tratamiento de un paciente requiere solo un día, como una simple operación, ellos pueden ser eh, ingresados en la unidad de cirugía de ese día. Bienvenido al Royal Infirmary. Entrada del sur. Entrada del sur. Parqueos de los autos, visitadores y personal de Centro de Salud Reproductiva Simpson, ginecología, maternidad, neonatología, departamentos ambulatorios, todas las salas, guía de cirugía, unidad de día de cirugía y endoscopía, departamento de rayos X y evaluación combinada. Pacientes ambulatorios, doctor Barro. El departamento de accidentes y emergencias, también llamado casualty, es donde los pacientes que están gravemente enfermos con una afección repentina y grave acuden para la evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita para ver a un especialista van a una clínica en uno de los departamentos de pacientes externos. Por lo general han sido referidos al hospital por por su médico de cabecera, quien escribe una carta de referencia al consultor explicando el problema del paciente. Pacientes hospitalizados. Los pacientes hospitalizados en un hospital son admitidos de una de tres formas principales. Pueden ser atendidos en una de las consultas externas y ser admitidos desde allí, o si hay mucha demanda en el tratamiento que necesitan, como en el caso de una prótesis de cadera, se les pone una lista de espera para su ingreso. Alternativamente, su médico de cabecera puede organizar la admisión por teléfono porque están gravemente enfermos, por ejemplo, con sospecha de infarto de miocardio. O se les atiende en urgencias, donde el médico de guardia que trabaja en ese momento organiza el ingreso. Esto ocurriría en caso de un paciente con fractura de cuello de fémur, por ejemplo. Los hospitales más grandes pueden tener una unidad de evaluación donde los pacientes pueden ser admitidos temporalmente mientras se evalúa su condición. Evaluado, sí. Se toman decisiones sobre su condición y lo que se necesita hacer para ayudarlos. Y una vez finalizado el tratamiento, el paciente es dado de alta nuevamente al médico de cabecera. Capítulo 10. Servicio Nacional de Salud. El Servicio Nacional de Salud es responsable por la atención médica para todos en el Reino Unido, aunque un pequeño número de personas eligen pagar atención privada. El tratamiento es gratuito, pero hay un cargo de, existe un cargo por prescripción de medicamentos y aparatos, como un collarín cervical, con excepciones para algunos pacientes, como los niños y los envejecientes. Hasta la atención primaria es dada por eh, es proporcionada por los médicos generales o los médicos de cabecera, enfermeras, dentistas, farmacéuticos y ópticos. Los médicos trabajan en prácticas de 1 a 20. Las prácticas se basan en un quirófano y cuidan de la salud de 1.000 a 15.000 personas en su comunidad local. También brindan educación sobre la salud en áreas como el tabaquismo y la dieta. Administran clínicas, administran vacunas, por ejemplo, contra la influenza y pueden realizar cirugías menores como la eliminación de verrugas y lunares. Si un paciente necesita atención especializada, el médico de cabecera hará una revisión, remitirá al paciente a un consultor en atención secundaria. Normalmente se atienden a los pacientes con cita previa. Las visitas domiciliarias se realizan cuando los pacientes están confinados en sus casas y no pueden salir de sus casas o están demasiado enfermos para asistir a una cirugía. El tratamiento de fuera de horario, OOH, de 6 p.m. a 8 a.m. lo proporciona el Primary Care Trust Local, que organiza turnos médicos de médicos generales y médicos suplentes para cubrir la ausencia de alta. Nota, el sustantivo cirugía tiene 3 significados. El edificio donde se trabajan algunos médicos de cabecera, el consultorio se ha trasladado a una nueva consulta, el consultorio se ha trasladado a una nueva eh, cirugía, consulta en el High Street. Un momento en el que el médico de cabecera ve a los pacientes. La cirugía matutina es de 8:30 a 12:30 y el trabajo de los cirujanos. El paciente necesita una cirugía urgente en el apéndice reventado. Ah, equipo de práctica. Una práctica típica de del médico de cabecera emplea recepcionistas. Son responsables del contacto inicial con el paciente, programar citas, recibir las solicitudes de recetas repetidas y recibir mensajes de pacientes y otros proveedores de atención primaria, y archivar y escanear documentos en registros de pacientes. El gerente de la práctica tiene la responsabilidad de las finanzas y a veces de IT. Supervisa al personal de recepción, contrata suplentes y ayuda a preparar el plan de desarrollo de la práctica. Los enfermeros practicantes dirigen clínicas de asma, diabetes y enfermedades cardiovasculares, así como las clínicas individuales para aquellos que desean dejar de fumar. Además, además del personal de práctica, los médicos de cabecera trabajan con varios profesionales de la salud. Las enfermeras de distrito visitan a los pacientes temporalmente confinados en sus casas, como pacientes hospitalizados recientemente dados de alta, para cambiar vendajes y para cambiar como vendajes de úlceras. Los visitadores sanitarios visitan a familias para realizar chequeos a niños pequeños, especialmente a los menores de 5 años, para asegurar de que estén sanos. Se presta especial atención a las familias necesitadas, como las que viven en la pobreza. También vacunan a los bebés. Las parteras administran clínicas para pacientes prenatales. Los fisioterapeutas brindan tratamiento práctico, pero también enseñan a los pacientes ejercicios que pueden hacer para mejorar su condición después de un accidente u operación. El día de un médico de cabecera. El doctor Stuart trabaja en un consultorio en una pequeña ciudad comercial con otros 3 médicos de familia. El, esta es una, el quirófano está en el centro del pueblo y es compartido por 3 consultorios. Eh, es, esta es una típica mañana de trabajo en la que ella no es el médico de guardia responsable de las emergencias y problemas urgentes. 8 de la mañana, 8 de la mañana, llegar a consulta, revisar los emails de los correos de fuera de hora. Mm, Revisar los mensajes urgentes y no urgentes y revisar los correos electrónicos de la Junta de Salud. Y 8:30, revisar los correos electrónicos de la Junta de Salud y preparar para cirugía. 8:30, 10:50, preparar para consultas. 8:30 a 10:50 de la mañana, consulta de la mañana. 6 previamente agendados de la semana pasada, 2 agendados 48 horas antes y 4 agendables en el día. Y de 10:50 a 10:55, pues, chequear la recepción por mensajes, eh, firmar prescripciones y tratar con la repetición de recetas. De 11 a 11:20, descanso para tomar café en la sala de conferencias con colegas. De 11:20 a 11:30, chequear consultar las solicitudes de visitas a domicilios y dividirlas. Y 11:30 a 1 p.m. Visitar a domicilio. Capítulo 11. Educación médica 1. Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre responsable de educación médica, educación de pregrado, 4 o 5 años en la Facultad de Medicina, la sección de una universidad de un programa básico de 2 años que brinda capacitación para nuevos médicos después de graduarse, hasta una serie de prácticas con diferentes especialidades. Capacitación de posgrado que los médicos toman para convertirse en médicos de cabecera o consultores, a menudo impartidos a través de colegios para diferentes especialidades, por ejemplo, el Royal College of Physicians. Desarrollo profesional continuo en forma de cursos y seminarios que los médicos realizan a lo largo de su vida laboral para mantenerse actualizados. Extracto de un prospecto de pregrado. El MBCHB, licenciatura de medicina, licenciatura en cirugía, es un curso de pregrado de medicina de 5 años La mayor parte del aprendizaje tiene lugar en grupos pequeños. Los componentes principales son núcleo, años 1 y 3, un programa integrado de temas clínicos y científicos preparados principalmente a través de aprendizaje basado en problemas, PBL, donde se trabaja eh, con otros en una serie de problemas de casos. Módulos seleccionados por el estudiante. Los módulos seleccionados por el estudiante, SSMS, le permiten elegir entre un menú de materias como medicina deportiva o incluso estudiar un idioma como preparación eh, para una electiva en el extranjero, un anexo hospitalario de su elección entre los años 4 y 5. Eh, Estudios vocacionales y destrezas clínicas. Este componente te prepara para las destrezas clínicas. Requiere, requiere contacto con los pacientes desde el año 1 de tu curso, eh, por periodos de entrenamiento práctico, donde tú estarás en, en un hospital, en un departamento de un hospital o en una práctica general. Fijación clínica, años 4 y 5. Una serie de, una serie de 4 semanas de fijación clínica en medicina, cirugía y medicina psicológica, salud infantil, obstetricia y ginecología y medicina general. Punto de vista de un estudiante. Ellen, una estudiante de medicina, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucras con los pacientes desde el principio. Incluso en nuestro primer año pasamos tiempo en el hospital. Gran parte del curso es PBL. Tenemos 2 sesiones de 2 horas a la semana, donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema. Buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos. Es una gran manera de aprender y conocer a otros estudiantes. En el pasado, los estudiantes de medicina tenían conferencias con toda la clase, tomando notas de los profesores de 9 a 5. Pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en pequeños grupos con un tutor. Me gusta todo, incluso la disección. Llegamos a descuartizar cadáveres a partir del segundo mes del curso. Capítulo 12. Educación Médica 2, el programa básico. El programa básico es un programa de capacitación de 2 años que sirve de puente entre los estudios de nivel universitario en la Facultad de Medicina y la capacitación especializada o práctica general. Consiste en una serie de prácticas, cada una de 4 meses de duración, que permiten al médico de información, conocido como becario, probar diferentes especialidades, por ejemplo, pediatría. Una capacitación del año 1 corresponde a los puestos de funcionario interno de preregistro. Una capacitación del año 2 a los puestos de funcionario de interno superior. Cada pasante tiene un supervisor educativo que se asegura de que los médicos más experimentados brinden capacitación de diferentes maneras, incluida la supervisión clínica y educativa. Para progresar, los alumnos deben demostrar una serie de competencias clínicas que se evalúan a través de la observación en un lugar de trabajo. Personas en educación médica, tutor, un académico o en algunos casos, un estudiante posgraduado que lidera tutoriales. Demostrador, En enseñanza de anatomía, alguien que demuestra cómo diseccionar. Los demostradores son normalmente posgraduados, estudiantes posgraduados, pagando, que pagan sus estudios, que pagan sus estudios en la Facultad de Medicina. Eh, lec- eh, lector o lector senior. Un académico senior que con responsabilidades de enseñanza, no, un académico con responsabilidades de enseñanza y- e investigación que contribuye con las enseñanzas de una disciplina en particular. Profesor, profesor, un académico senior con responsabilidades de enseñanza e investigación para una disciplina en particular. Suele ser la figura destacada en su disciplina. Eh, Tutor universitario, un consultor responsable de impartir un programa de formación universitaria. Consul- eh, Capacitador clínico, un consultor asignado a un aprendiz que brinda una capacitación durante los periodos de atención clínica directa. Y un supervisor educacional es un consultor que supervisa el periodo de formación de un aprendiz. Calificaciones médicas. Eh, PMSC, PMSCI. Licenciado en Ciencias Médicas, un título que a menudo obtienen los estudiantes que desean seguir una carrera en investigación médica después de 3 años de estudios médicos. MBCHB, MBBS, PMBCH, BMDS. Licenciado en Medicina, licenciado en Cirugía. Los títulos de licenciatura son títulos de pregrado. Este es el primer título para los médicos de Reino Unido. MD o DM es doctor en medicina. DRCOG es el diploma del Royal College de Obstet- Obstetrics y Ginecología. MRCP, MRCS. Miembro del Royal College de Médicos o miembro del Royal College de Cirujanos. Los médicos se convierten en miembros al completar con éxito los procedimientos de evaluación en su colegio. Miembro FRCS, FRCS, FRCS Class, FRCSI. Miembro del Colegio Real de Cirujanos de Inglaterra. Otras universidades se indican con las letras que siguen, por ejemplo, Edimburgo, Glasgow o Irlanda. La forma en la que los médicos se convierten en becarios depende de su universidad. Para el FRCS se deben aprobar exámenes adicionales. Para otros colegios es por nominación o evaluación de trabajo. Capítulo 13. El médico extranjero. Tipos de registro. Para gestionar y tratar pacientes en el Reino Unido, todos los médicos deben registrarse en el Consejo Médico General. Hay varios tipos de registro. El registro provisional es para médicos que acaban de graduarse de la Escuela de Medicina en el Reino Unido o de ciertos estados miembros del Espacio Económico Europeo. La inscripción completa es para la inscripción o registro completo es para médicos que han completado su año de capacitación clínica. El registro limitado es para graduados médicos internacionales que no hayan completado el equivalente a un año de capacitación clínica en el Reino Unido. Y el registro especialista es para médicos que han completado la formación médica especializada y tienen un certificado de finalización de formación, CCT. El registro EP es un registro de todos los elegibles para trabajar en la práctica general en NHS. PLAB. Antes de que puedan obtener el registro completo, algunas categorías de médicos extranjeros deben realizar esta prueba de la Junta de Evaluaciones Lingüísticas y Profesionales, la PLAB. Está diseñado para garantizar que los jóvenes aprueben, puedan practicar de manera segura al nivel de un SHO en una primera cita de un hospital de Reino Unido. La parte 1 consiste en una prueba escrita de conocimientos, habilidades y actitudes. La parte 2 es un examen clínico estructurado objetivo. Consta de 16 escenarios clínicos de 5 minutos cada uno, conocidos como estaciones, para evaluar las competencias profesionales. Estaciones y consejos de PLAB. Los OSCE evalúan esas habilidades. Examen clínico. Su capacidad para realizar un examen físico de un paciente simulado. Se evaluará un actor capacitado para desempeñar este papel. Los exámenes íntimos o incómodos se realizarán en un maniquí, un modelo automático. Anatómico. Habilidades prácticas. Se evaluarán sus habilidades prácticas como suturar y aplicar inyecciones intravenosas. Habilidades de comunicación. Se evaluará su capacidad de interactuar con un paciente simulado o, en algunos casos, con el examinador. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre el estilo de vida. Elaboración del historial clínico. Se evaluará su capacidad para elaborar una historia precisa y realizar un diagnóstico razonado. Consejos sobre las sensaciones de un candidato exitoso. Lea atentamente las instrucciones para de cada estación. Tienes 5 minutos para esto. Ten en cuenta las precauciones de seguridad, como tirar los objetos punzantes en el contenedor de objetos punzantes. No olvides el protocolo ABC, vías aéreas, inspiración y circulación en cada estación de emergencia. Verifique que el paciente comprenda lo que está sucediendo. Luego pregúntele acerca de cualquier inquietud que pueda tener. No se limite a darle una conferencia. Escuche atentamente lo que el actor dice. Nota. Los punzocortantes son agujas y hojas que deben ser desechadas de forma segura en un contenedor especial llamado contenedor de objetos punzantes.